Welcome back to Save Your Money, Save Your Teeth. I'm Eon from eRadio SA, and today we're tackling a critical stage of life, the teenage years. Joining us is Dr. Clifford Yudelman from OPTISMILE to discuss why even the most cavity-free kids can suddenly face dental drama once they hit high school. So we're diving into the Teenagers' Survival Guide to Oral Health. Dr. Yudelman, welcome back.
Yeah. Thanks, Eon. Great to be back. And I can't believe January's already finished. Wow, we're into February now.
Yeah, and that means 2 years of Save Your Money, Save Your Teeth. Is that correct?
Yeah, 100%. I think next week or Valentine's Day will be our 2-year mark.
Unbelievable, eh? And here we are on 93 episodes already. That's quite an achievement.
Amazing. Well done to you.
Well done to you. Interesting.
We've got another 50 or so up my sleeve, so that we'll have to keep going.
Okay, awesome. Dr. Yudelman, this is a very interesting topic. I want to start off right away and ask you, why do teenagers suddenly get a spike in cavities after years of actually being cavity-free?
So a lot of the stuff we're going to speak about today, we've spoken about in various episodes, but I thought since we did the 0 to 3, 3 to 6, 6 to 12, let's do one for teenagers, and then next week we'll do one especially for men or males, specific things. So if you're a teenager, you have a teenager, this one's for you. So the spike in cavities, that's really something we see a lot. It's very frustrating and it's common, especially a parent. You've got a few kids and then they get away with no cavities, and then suddenly at 16, 17, there's cavities. So children with excellent teeth in primary school getting cavities when they're teenagers, coming out of nowhere. But it's really a number of risk factors that converge all at the same time. You know, the main thing, what happens with teenagers is the behavior changes. They become more independent, as you know, especially over food choices. It's impossible sometimes to get them to brush their teeth. You know, trying to speak to a 10-year-old versus a 16-year-old is a bit different. You know, brushing becomes rushed. Often they stop flossing if they were flossing. Late nights, bedtime, they miss bedtime brushing. The diet has shifted. They eat a lot more sugar. They start with sports drinks, energy drinks, Red Bull, all of those things, all very acidic types of things, juices, and they spread it out throughout the day. And each time you have something sugary or acidic, it triggers an acid attack that softens the enamel for up to an hour. So they're doing this every couple of hours. The enamel's just being softened all the time. And the third thing is the saliva changes, which is quite interesting. The hormonal fluctuations during adolescence can affect saliva flow and composition, and can actually reduce the buffering effect. And, you know, the saliva is the mouth's natural defense system. These studies have shown that this is because of diets and behavior. It's not just a sudden biological weakness of the teeth. And the take-home message really is that teenage cavities are predictable and preventable, and maintaining structure, making sure they keep using fluoride toothpaste or hydroxyapatite toothpaste that we mentioned if somebody's trying to avoid fluoride. You know, the regular monitoring during this life stage can save a huge amount of future dental costs and damage. A lot of people start missing that 6-monthly or annual exam, and it catches up. Finally, you know, they come in when they're 20 and they haven't had an exam in 4 years, and there's always cavities.
Exactly. And, you know, the kids love their energy drinks and sports drinks. But, I mean, what is the real impact of these drinks on your enamel as a teenager?
Yeah, so it's much worse than what parents realize. To add to what we were saying earlier, it's not just about the sugar. A lot of these are very highly acidic, which means that they have a low pH. And anything with a pH lower than 5.5 will actually melt or erode the enamel. When the enamel is exposed to the acid, it softens and it just, they don't get enough time to remineralize. If you add sugar to that just makes it worse. And they often will sip on these drinks slowly, you know, have 2 or 3 of these drinks that make them last the whole day. And so their teeth are just being bathed in acid. And yeah, it's really quite crazy how we see this severe erosion on a young patient, 18, 19, 20 years old. The enamel doesn't grow back. We only used to see that type of erosion on 50 and 60-year-olds, and now we're seeing it on youngsters like that. And from a practical standpoint, these drinks shouldn't be drunken every day, or you shouldn't consume them every day. Water is the default. Personally, I've switched from a plastic bottle to a glass bottle, whatever that's worth. And I just fill it up at the tap. I have a filter. I don't even use that. I just drink tap water myself. I think depending where you live, tap water is probably the best thing. And yeah, it's much better than drinking cold drinks or juice. And make sure that if you do have something acidic, that you have it with a meal and you follow it with water. Brushing should always be delayed for at least 30 to 60 minutes after you have an acidic beverage. You don't want to drink one of these and go and brush. That's even worse.
Yeah.
Because your enamel gets soft and then you're going to go and brush it away.
Exactly. And then apart from the energy drinks, very popular is vaping nowadays. Is vaping safer for your teeth than smoking? Any hidden dangers for teenagers?
Yeah, so vaping is often marketed as a safer alternative to smoking. But from an oral health perspective, it's far from harmless. While it eliminates the combustion products, it introduces other risks that are particularly relevant to teenagers. Most vaping products contain nicotine and other chemicals that reduces blood flow to the gums, and this can mask early signs of gum disease such as bleeding and allows damage to progress silently. Vaping is also associated with dry mouth, and we've spoken about saliva a lot. Reduced saliva increases the risk of cavities, can give you bad breath, and also cause gum inflammation. And now new research shows that vaping changes your oral microbiome, the bacteria in your mouth, and that favors bacteria linked to gum disease. And although it's newer than smoking and the long-term data is still developing, the evidence so far suggests that it's not harmless to your oral tissues. And for teenagers, the additional concern is addiction, because nicotine dependence affects behavior, attention, and long-term health choices. So my advice is clear, and I'm quite conservative on this. Vaping is not safe for teeth or gums or your overall health, and it shouldn't be viewed as a harmless habit simply because it's not, cigarettes. My personal opinion is that I think they're going to find that it's way worse than cigarettes, because it depends. There's so many different, there used to be like maybe 20 or 30 cigarette manufacturers, and they were all doing the same thing, growing the plants, drying it, rolling it up, putting it in a little paper thing with a filter. But with vaping, you don't know what chemical is in that thing. You don't know what you're breathing. Some of it smells like apples and peaches and who knows what, cinnamon. I mean, that's all going in your body, in your lungs.
Yeah, and you already have, teenagers battling with conditions like popcorn lung and all that stuff at a very young age.
Yeah.
Caused by
popcorn.
Yeah, you know about popcorn lung, I'm sure, and caused by vaping and what's the other one? Hubbly bubbly.
Oh yeah, I mean those things. How can they be good for you? Sometimes you got to just grow up and listen to the grown-ups, I guess.
And it's not a teenager if there's not a piercing. So, what? There has to be a piercing somewhere. Yes. Can we talk about oral piercings like tongue or lip studs? Do they actually affect your gum health and your tooth structure?
Well, lately I haven't seen too much of this, but when it first started, I was in California, and I actually had a young Filipino male patient that bit on his tongue stud very hard by mistake, actually. And he split his tooth right down the middle. It was terrible.
Oh,
I was able to save his tooth, but we didn't really even have injection molding or anything back then. I remember, I think he got 2 veneers or 2 crowns. But it was early days. And I've seen quite a number of patients when they have like a lip ring or something, it rubs on the gum and it causes recession. I mean, if you do have that, it's not too late to take it out, and the gum can grow back, or you can get minor grafting. But long term, those things do mess up the gums. They rub on them thousands of times a day. I've had patients break back teeth. I've had patients, that keep playing with their tongue bar or tongue ring. I mean, that's just generally annoying. Maybe it's meant to annoy adults, but people get into funny habits. As I say, you can get surgery if your gum does recede, but you really don't want to break a tooth. And then also doing these piercings right in the middle of the tongue. There's a lot of nerves there. There's people that have had permanent nerve damage. You can get infections, but there's lots and lots of literature where they've studied all of this, and the cost to repair the damage, far exceeds the prevention. And from a long-term perspective, oral piercings are high risk and a low reward decision for dental health.
okay. And let's say they've got braces. So what is the best way to clean around those braces if the teenager is not too fond of flossing?
Yeah, look, flossing, I mean, that's why we do only Invisalign at OPTISMILE. I've got 2 dentists that know how to and can do braces as well, but they much prefer Invisalign because patients can brush and floss as normal. Orthodontic braces cause plaque traps. It becomes difficult. Flossing with braces is very difficult. You want to reduce harm. So if someone does have traditional braces, you can get these tiny little brushes, not the little toothpick things. They're interdental brushes that you can use around and between the teeth and under the wires. A water pick or water flosser can help get food out. There's some really good electric toothbrushes now. Some of them have orthodontic brush heads, or a sonic brush will get around and in between works really well. We got some really good ones here at OPTISMILE. Some of them are super expensive. You don't need a super expensive one, but you need something with nice soft bristles. We have done podcasts about electric and manual brushes, and look, that's not an excuse. You got to keep them clean. My brother had braces when he was young, my older brother, and he also used to drink a fair bit of Coca-Cola, and I fix his teeth. He's my family member, and he's had years and years of suffering from not keeping his teeth clean when he had braces. You're talking in the 70s or 80s, but braces haven't changed since then. I mean, Invisalign has come along, but braces are still braces, and getting regular professional cleaning during orthodontic treatment is very important. Some orthodontists recommend that the patient go every 3 months to the hygienist. That's not only so much for us to clean your teeth, but to actually motivate you and show you where you're missing, and to prevent what's called white spot lesions, which is damage to your enamel from plaque sitting on the braces and on the teeth.
And doctor, at what age is it safe for a teenager to start professional teeth whitening?
A great question there, because it comes up all the time. So teeth whitening should generally wait until all the permanent teeth are in and the enamel is fully matured. Usually we like to wait till the late teenage years, 18, 19. Whitening earlier can increase the risk of sensitivity, but we will, and we have done whitening. I've done whitening even quite a while back on patients as young as 13 or 14 if they're being teased at school or don't want to go out, if they have significant brown marks. In fact, I remember a particular case even when I was back in California. I moved to Australia in 2002. So in the late 90s, I did whitening on some very young patients. It was unheard of then, but nothing happened. Their teeth got whiter, their confidence improved. Generally, it's not a fashion thing. We're talking about teenagers with the younger ones where they have severe brown stains and fluorosis. Yeah, you can't do it if there's cavities or gum disease or bleeding gums or significant erosion. The recommended for younger patients, say if it is under supervision and they're 14 or 15 for these really bad marks, is very weak carbamide peroxide overnight. But you definitely don't want to be doing anything over the counter or like off the internet or social media, all of these DIY products or whitening strips. The safest approach is to actually get it done with a dentist. I wouldn't go to a beauty salon or anything like that. We did 6 podcasts on whitening. So yeah, I think this question about what age can you start is very important. If someone has a question, they can set up a free video consult and I'll give them advice tailored to their own situation.
And then, how do puberty and hormonal changes specifically affect gum health? I mean, there's something called puberty gingivitis, I think.
Yes, so the puberty brings a big surge in hormones. It increases blood flow to the gums, and it changes the inflammatory response. It can make gum tissue more reactive to plaque, even when oral hygiene hasn't really changed or gotten worse. The gums look red and swollen. They bleed easily. They just got to improve their oral hygiene. And the research has clearly shown a correlation between puberty and this gingival inflammation independent of plaque levels. The solution isn't aggressive brushing. It's gentle plaque control. And education is important when teenagers understand that the bleeding gums are a warning sign rather than something to ignore. They're more likely to improve oral hygiene habits. And flossing is really important at that stage, as well as tongue scraping. If your gums are bleeding, then you could also have bad breath. That was our very first podcast on bad breath. Scraping your tongue will help. We do sometimes give teenagers special mouthwash and toothpaste that's got a tiny bit of chlorhexidine in it. Not the normal chlorhexidine that you buy over the counter that can stain your teeth, but the chlorhexidine that has, it's a non-staining, it's called Curacept, Curaden products are really good from Switzerland, just a small tiny amount of chlorhexidine, but not all the time, just to get things under control.
And when you're a teenager, all of a sudden you're going through so many changes, and then that's also when you get to meet your wisdom teeth, and it's either going to be wonderful and they're going to come in nicely, or they're going to cause problems like they did for me. Not pleasant.
Yeah.
So what are the early warning signs of wisdom teeth coming through in your late teens, doctor?
So we did, as you remember, a full podcast just on wisdom teeth quite early on. It is a common subject. We get a lot of people Googling that and finding our podcasts and our blog pages and our wisdom tooth page. So they usually begin to erupt in the late teenage years, although timing varies. Some early signs can be intermittent pain at the back of the mouth, especially on the lower ones. You get some swelling of the gum tissue. Sometimes it can be hard to open your mouth, and you can get a bad taste if food is trapping in that area. A partially erupted wisdom tooth, one that's just like a halfway in or quarter way in, is prone to infection because bacteria accumulates under that little gum flap, and this is called pericoronitis. It can become painful and it can happen over and over, and clinical examination with a dentist and x-rays are essential to assess whether there's enough space for the eruption or whether the tooth is actually stuck or impacted, it's called, where it's impacting on the tooth next to it, like jammed in there. Early assessment allows for planned management rather than emergency treatment during exams. Sometimes they'll flare up during exams or when you're on holiday or over Christmas or stressful periods. And monitoring the wisdom teeth early helps to avoid pain, infections, and last-minute extractions when it's not convenient.
And, children can be quite nasty in school, especially if you're wearing something that they can see, like braces or whatever. They'll call you brace face or whatever. So how can we encourage their teens to wear their retainers or aligners when they feel self-conscious about it, maybe?
Yeah, so obviously, if you got braces, then there's no getting away from that. They're stuck on there for
Yeah.
18 months or 2 years or 3 years. So what we're talking about here, because more and more, Invisalign and retainers are more common, is the teenagers need to understand that the parents spent a lot of money on getting their teeth straight, and the teeth can move back or relapse, we call it, very quickly after orthodontic treatment, and the relapse often leads to the need for retreatment, which again is costly and it's frustrating for the parents. Normalizing appliance wear is important, and many teens assume they're the only ones wearing retainers or aligners, and these days there's quite a few people with them. Clear aligners or discrete retainers help, but I think, we show patients what it looks like if you don't wear your retainers and your teeth move back to where they were. And usually the parents, because they spent a lot of money, are the ones that make sure that the kids are listening. And retainers are insurance. You wear them now or you pay for it later.
That's a good one. It's just so fascinating how your teeth can move, eh? I mean, it takes time, but it's incredible how they can move.
Yeah, they move your whole life.
It's amazing.
If you develop a habit like chewing on your pen, that tooth will start moving forwards. Or
Wow.
if you bite your nails, and the teeth will move inwards.
That's amazing. Also, just one more question, Doctor. Is bad breath in teens usually hygiene related, or could it be even tied to their diet?
So in the vast majority of teenagers, bad breath is due to oral causes, something going on in their mouth. It's very rare that it's the stomach, unless they're burping all the time, or some kind of abscess or infection in their nose. It's generally the plaque buildup on the tongue coating, dry mouth from not drinking enough water or having too many energy drinks and not enough water. And then also like poor oral hygiene, trapped food in between their teeth. Diet also plays a role, especially high protein foods. I mentioned, biltong, but even like a protein shake. Then also sugary snacks and energy drinks. These can cause bad breath. Dehydration, we mentioned, especially if the teenagers are playing a lot of sport and not drinking enough water. Like I said, systemic causes or like general health causes of bad breath are very rare in this group. So good brushing, tongue scraping, hydration, drinking lots of water, making sure you floss, getting rid of gum inflammation, and that usually sorts out the problem. And persistent bad breath should be assessed professionally and not masked with mints or sprays. There is something called a tic-tac cavity. I don't know if you remember, you've tried those tic-tac mints.
Yeah.
They're little they're tiny little mints, and you normally stick them up next to your like upper molar at the back there, and you can get a cavity right there on that tooth.
Oh.
We call it a tic-tac cavity. I haven't seen one in a while.
Wow,
Yeah.
okay.
I just look in someone's mouth, and sometimes they have a bit of a greenish look to them. And I say, so you like to keep your Tic Tacs on the upper right? Yeah. And they go, how do you know?
Wow, that's
because you
so
got a
cool.
hole. Yeah. And treating, getting rid of the actual, whatever's causing the bad smell is way better than trying to cover it up with a Tic Tac or a breath mint or mouthwash.
Exactly. Okay, well, that was so interesting, and that also wraps up our survival guide for the teens in your life today. Dr. Yudelman, thank you so much for joining us again.
Thank you, and looking forward to speaking to you next time.
Absolutely. Next week, talking about men's oral health, the silent crisis. That's bound to be very interesting as well.
Yes, and have a good week until next week.
Thank you, you too. And remember, teenage cavities are predictable and preventable with the right structure and monitoring. To our listeners, protect that enamel now. It's the best way to save your money and your teeth. Until next time.
Discover the world of dental excellence with OPTISMILE. join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OPTISMILE or book directly online on optismile.co.za. OPTISMILE, where global expertise meets local care.